synaptic. Excuse me. Because it's where the action is going to take place, we also call it motor end. Motor end. Okay? All right? Yeah. Oh, hang on. She was going to ask a question first.
Go ahead, Lana, go ahead.
Okay, you sure?
Yeah.
Okay, all right, go ahead.
Can you just stand on the other side now and explain it to you? Because you stand right.
Okay, I was
so
blocking
we
you
don't know what
guys.
you're pointing
Oh,
to.
I'm sorry.
We literally cannot see
Kinda right in
anything
front of
you're
you.
pointing
Oh,
to
okay.
on the
All
wall.
right. Okay.
What kind of goes with what here?
Okay, hold on. So this is the brain. Remember we said this is the brain, and this is the spinal cord, right? Spinal cord. Okay. The spinal cord is an extension of the brain. Okay, it sends out spinal nerves to innervate muscles. Remember I said every muscle has innervation. Innervation means they are supplying it. Okay, because the control of our body is majorly by the central nervous system and the other system that we call the endocrine system, okay, which we're going to get into, all right? Because we're dealing with the nervous system right now. So for this muscle to contract, it needs nerve stimulation. So the nerve is coming out. I said the nerve doesn't touch the muscle directly. Okay, there is a space between them. So I blew it out. I blew it out. So this is still the muscle. Okay, this is the nerve. So this nerve coming, it divides. Then we have this one trying to innervate the muscle. Okay? Now, the space between the nerve and the muscle is what we call neuromuscular junction. Or it's also called synapse or synaptic clicks. Okay?
So that whole word there is all of that.
Yes.
Three things.
Or this or this. Okay? Now, this space, there's a space there. Because it's not touching directly, on the nerve ending here, which is what we call the presynaptic. Before the synapse. Before. Okay? So there are vesicles. So I took this out, I blew it out again. So we have vesicles in here. So these vesicles as neurotransmitters. Hang on. So the neurotransmitters. All right. So the neurotransmitters they are right inside these vesicles at the nerve ending, the presynaptic area there. Okay. Now, so the neurotransmitters is going to help the action that is coming from this nerve to be transferred to the muscle.
Is that circle part of the nerve, or is that?
It's part of the nerve. It's part of the nerve.
Yeah.
So the
at
nerve
the end
ending.
at the end of the nerve, it looks like a bulb.
Yes. It looks like a ball.
Which is
Exactly.
the
Presynaptic.
and in that is the vesicles, and then the
Yes.
vesicles are the
Neurotransmitters.
Gotcha, that makes
Okay.
sense.
That's
Right,
whatever that
neurotransmitters.
word is.
So
Hmm?
the word under neurotransmitters there, is that part of the neurotransmitter part?
Which one?
That one.
Neurotransmitter. An example of neurotransmitter is acetylcholine. So let me just put EG. EG means example, right?
Yeah.
Yes, example, okay?
Yeah.
Acetylcholine. Okay?
So like
Huh?
when you have a disease like ALS, is that what that attacks?
Damn, there you go. That's one of the problems that could happen.
Okay.
Okay, with the ALS, there is a problem that has to do with this nerve making a connection with the muscle, which we're going to talk about eventually. Okay? Yeah, that's part of it. Or when somebody has, let's say, any of the paralysis, like the ALS, muscular dystrophy. Parkinson is kind of a little bit different because Parkinson is more of the brain. Yes.
What about Huntington's disease?
The Huntington's disease, kind of similar too. Kind of similar because it's similar to the Parkinson's. Yes. But the problem has to do with something similar, but it's more in the brain. It's more in the brain. Okay? All right, everybody gets this? All right, so let's define neurotransmitters now, right now. Neurotransmitters. So neurotransmitters, they are chemical messengers. Neurotransmitters are chemical messengers, which are, so they are chemical messengers. They are neurotransmitters. Neurotransmitters are chemical messengers. Chemical messengers. Chemical messengers. More like hormones. Chemical messengers that help to facilitate an action. Okay? An action. Particularly between the nerve and the muscle, or nerve to nerve. Because this is nerve to muscle. Between nerve and nerve, dendrites, they don't make a direct connection. There is a space between themselves also. So there are also neurotransmitters. When somebody is low in mood, okay, which means is depressed, because it might be there's a low level of that neurotransmitter that helps to raise the mood. Okay, an example is norepinephrine or epinephrine or serotonin and all that. Okay, so when we are treating a patient for depression, we give the patient serotonin reuptake inhibitors. So which means something is actually killing the neurotransmitter that is not helping it to work in nerve to nerve right now. So we give a medication that is going to block the serotonin from going back so that we can make it more available at this junction. I'm talking about nerve to nerve right now, so that that patient can feel high in mood. Okay?
So do nerves, they grow back?
It depends. Not usually. It depends.
Because the question I was gonna ask, I had my nerves burnt in my back, radio frequency thing, but I was trying to figure out, do they grow back? Because on my disc.
Yeah, it depends. Particularly the peripheral, they might, but the central nervous system nerves, not often. Not often.
Okay.
Yes. So it's not something that is automatically they're going to grow back.
Oh,
So it
all
depends.
right.
Yeah. All right. So that's neurotransmitters. All right. So there are three classes of neurotransmitters. We have what we call excitatory. Excitatory. We have inhibitory and neuromodulators. Neuromodulators. So, three types of neurotransmitters. So I'm going to put it NT, neurotransmitters. All right? We're still going to talk about it. But just understand, when we say excitatory, what do you think is happening? It excites. So people that takes cocaine and all that, it's actually helping more of neurotransmitters to be much more available. So they get excited. Coffee stimulates the growth. Kind of similar. Okay? Then inhibitory means they cause an action to go down. Okay? Then neuromodulators. They are a type of neurotransmitters in which they modulate an action. Okay? Everybody clear with that? All right. So that brings us to that innervation thing, because the innervation of the muscle is very, very important. For any muscle to contract, they have to be innervated and through the neuromuscular junction. All right, let me bring another interesting thing. You guys heard about botulinum toxins, right? Botox. Botox. All right. Remember that when we get old, because the way the acetylcholine works with the muscle, that is what contraction and relaxation. Contraction and relaxation. So when the acetylcholine is released, it binds to the muscle to contract. After the contraction, it should go down, right? But remember that wrinkles are permanent contraction. Okay? So what we do is, when we inject the Botox, the Botox goes and help to stop the action of that acetylcholine so that it can stop it. So produces what? It blocks the action of the acetylcholine. It now produces a type of paralysis, which is the flaccid, which now makes it much more not wrinkle. Okay, because a patient can have two types of paralysis. We can have what we call spastic. Spastic, I'm going to explain that. Spastic paralysis and flaccid paralysis. Spastic is when this acetylcholine, we often designate it as ACH. When it's released right here, ACH, acetylcholine, then it binds here to initiate the action. But in some cases, it just stays there. In the case of the wrinkling, just stays there. Okay? But in a normal circumstance, there is something that helps to destroy the action, that terminates the action of that acetylcholine. Okay? What helps to terminate the action of that acetylcholine? We call it acetylcholine esterase. Acetylcholine esterase is an enzyme that helps to destroy acetylcholine, and it brings the thing into relaxation. Okay? So, if, for instance, there is something that is working against acetylcholinesterase, in which is not allowing to destroy this acetylcholine, then the patient remain spastic, contracted position,
Tight.
tight. Tugs, what is this? Tetanus. You know, we take shots, right? Tetanus shots.
Oh, tetanus.
Tetanus, yes. If we don't take tetanus shots, tetanus, yes. If we don't take it, you know, if we have a tetanus infection,
Get locked up.
You lock up.
yeah, you Google it. You don't see the picture that has it, right? Long jaws, yeah. Long jaws. Everything is. Yeah, I know, right? Right. Okay, we call that position opistotronous position, but don't worry about it. You can get it in long jaw positions. Everything is just firm. And one of the problem is, if we don't do something about the respiratory, if we don't intubate the patient, the patient can die. How? Because of the diaphragm, the muscles of the respiratory can get paralyzed, and the patient is not able to breathe. Okay, so that's passive. Now, flaccid means the acetylcholine, something is destroying the acetylcholine. It's not even able to contract at all. As a result, the muscle is not